We're speaking with Marc Holland. He's the CEO and the Managing Director at System Research Services. Marc, thank you very much for coming.
It's a pleasure, Mike. Thank you for having me.
I want to talk to you about interoperability, about medication reconciliation, and about e-referral. But first, would you tell us what System Research Services does?
Well, we are an IT market research firm and advisory services organization that caters specifically to health IT, with a primary focus on the provider segment of the healthcare industry. And drawn upon my background as a consultant, as a hospital CIO, and as a market research analyst and program director for a number of years.
So you research all the effectiveness of the technology and the procedures in the entire healthcare industry?
Yes, with a specific focus on EMRs, telemedicine, remote patient monitoring, the federal sector, and all the initiatives at the state and the federal level. The connectivity of all of those islands of automation through the form of health information exchanges and the like.
So then interoperability. What do physicians, CIOs, CEOs, hospital clinicians, what do they really need to know about interoperability from the perspective of somebody who analyzes the system?
Well, let me step back. What's the end product of interoperability?
Right.
It's really how do I find an effective way of standardizing the information that I have, normalizing it, and exchanging it between unrelated parts of my organization or even with other organizations in such a way that physicians, nurses, other practitioners within my organization, or people in the community have the ability to look at what I collected for a patient when they were treated in my hospital or in one of my clinics, and what information was gathered when they were treated at a competitive hospital down the street or one of my other facilities, so that we have a continued sort of objective and comprehensive record of our care for that patient, so that someone who has never seen this patient before not only sees what's before them in the examining room, but knows the history of the patient in a clinical fashion, not just from the recitation of the patient. I had this operation, I had that operation, I've had this illness before. So it's a much more comprehensive, much more clinically focused view. And that's really what the continuity of care and where the healthcare reform process really wants to take us, is to provide a whole view of the patient so that we don't repetitively do testing, so that we don't focus on problems without understanding what the patient's medical history fully has been, and we don't know where that patient has been in terms of other physicians, what they have found in that case, and we discover that all over again. And that's just it's a waste of the patient's time, it's a waste of the society's healthcare expenditures.